Hello, everyone. This is Taquayan Brookins. My apologies for being a little late. A little technical difficulties, but we're going to get started here in about 2 minutes. I just want to give folks a chance to dial in. I know I personally had the wrong meeting ID. And so I just want to give other folks an opportunity to dial in before we get started.
joined the meeting. Okay. I guess we'll get started. I think we have enough people on the call.
Oh no.
No?
Hello everyone. I've been talking for the past 10 minutes and did not realize that I was on mute. Oh
Okay.
no.
I was gonna start. I was just like, I'm gonna get started.
I thought
Yeah,
something was wrong with everyone else's phone,
no,
and
I've
I
been
have
sending
literally
you
been
texts
talking.
I've been sending you text
I
messages
see
and
them,
chat.
but I didn't. Okay,
I
let's
sent
start
a
over.
message too. I was just gonna get started. I was gonna say I was gonna greet everyone and just like.
Yeah, no. I gotta start over. I'm so sorry. I was just talking away and wondering why everyone was so quiet. This all makes so much sense. Okay, let's start over. Sorry about that, everyone. All right.
Abbreviated version, because we weren't late.
I'll talk faster. I won't abbreviate, but I'll talk faster. Anywho, okay, welcome everyone to our task force call. I just wanted to go over some quick housekeeping items. We have a few new guests on the call, so I just wanted to go over those, and then we'll get started. So this meeting is being recorded, as you may or may not know. I won't be sharing my screen this time, just to minimize the usage of the internet and speed and all of that. If you could keep yourself muted, but remember to unmute when you're ready to talk, that would be very helpful to minimize background noise. Please also state your name and your affiliation when you're speaking. For instance, if you're a Minority Freedom Community Fund task force volunteer or a board member, if you could indicate that when you speak during the question and answer or progress update portion of the meeting. We will, if you have a question while anyone is presenting, feel free to raise your hand. We also have the chat feature available. Our task force volunteer, Harit, has volunteered to monitor the chat features and the hand raising features of the meeting today. So if you do have a question, feel free to use that chat feature, and she will read your question when that time comes up. With that, I just wanted to go over a quick overview of our goal for today and how the meeting will be structured. So I wanted to spend a few minutes giving some updates on the progress that we've had over the past week, as well as some things that we're working on, and then spend a small portion giving a presentation on what to do if a quick health update. So some things to do to prevent yourself from getting sick, what to do if you or someone that you're being quarantined with is sick or may be exhibiting signs of sickness, how to stay physically and mentally healthy. So that will be about 10 minutes. And then the lion's share of today's meeting, we'll be doing a Q&A. So I really want to hear from you all, either guests or task force volunteers, what questions you have, what ideas you have, issues that you've seen come up in your communities, or that you may anticipate are going to come up. I'm happy to spend the lion's share of the meeting talking about those. And with that, I want to turn it over to our president, Ms. Nakia Powell-Thomas, to introduce herself.
Hi. I was just getting ready to start the meeting without Taquania. But I am the president of Minority Freedom Community Fund, and I just want to thank everyone for joining us this evening. A very special hello and welcome to those joining us for the first time. We do appreciate your time, everyone's time, and your desire to help us with this task force. This pandemic is affecting everyone. And I personally know people who have the virus, people who are caring for those with the virus, and people who have lost close and loved ones. So your support is definitely appreciated and needed during this time. So welcome again and thank you. And I'm going to turn it back over to Taquania so we can get started with the meeting.
Thank you, Nakia. So I just wanted to give a quick update on some things that we've done since our last meeting. So we did have one of our volunteers, Nicole, I don't know if she's on the call, I don't see her name, but one of our task force volunteers, Nicole, did work on a press release for us, which would we plan to distribute among media outlets, just explaining our organization and introducing our task force and our goals so that we can garner more participation and awareness around some of our initiatives So we're really excited and thankful to her for that. That does need to be circulated among our board first before it can be released, but it's in pretty good shape, and I anticipate that will be distributed before our next meeting. So that's one update. In addition, at our last meeting, we were able to assign duties to some of our task force volunteers, and we've had all of our volunteers working diligently to fulfill those roles. So I appreciate that very much. On yesterday, or the day before, my days are blending, sorry, myself and our president and another member of our another volunteer of our organization participated in a call that was held by the FDIC and the Federal Reserve Bank of Chicago, where they were discussing the Community Reinvestment Act and essentially how community organizations like ours could partner with banks to bring programming and financial products and services to low-income individuals and small businesses in areas across the country. And so this is something, when we think about our mission and we think about not only our mission, but the impact that COVID-19 is going to have on finances for minorities and their businesses. We really think that this is a great opportunity to use our connection to the community to help inform some of the programming that those banks offer. And so we'll be meeting on Monday afternoon. A few of us will be meeting with a consultant that specializes in getting community organizations affiliated with the banks under the Community Reinvestment Act program. We'll be meeting with her and then coming up with a game plan to present to our board to figure out what that partnership might look like for our organization. So more on that, really excited about that. And thanks to our new volunteer, India, for sharing that resource as well. I also wanted to give an update in regards to some of the recent legislation that's passed. So here in Michigan and in a lot of states across the country, there have been some stay-at-home orders that the governors have made. And so for us in Michigan, and I pause to say that the Minority Freedom Community Fund is a national organization. We're headquartered in Michigan, but our mission is to assist individuals all across the country. And we have volunteers and board members from various states. So, but in Michigan, the law as it sits results in a fine and up to 90 days in jail time if there are violations. And so we want to be really, really diligent in communicating to our communities that this is very serious and to be taken serious, because we don't want to have an instance where minorities are being targeted unfairly and then increasing, the incarceration rates that are already too high among our populations, for example. So we really want to make sure that, because that is now a law in our state and in other states, and going to be probably in all 50 states very soon, we want to make sure that we're doing our part to communicate to the community how important it is to abide by those. Another piece of some of the recent legislation that has passed in regards to healthcare, I just wanted to give a quick notice and update that folks who do not have health insurance or who are on Medicaid or Medicare do receive free testing for COVID-19. And in the event that they do come out with a vaccine for this, they will, that vaccine is assumed to be covered under that as well. So I know a lot of questions have been brought up around, what do people do if they don't have insurance, et cetera. They will be covered because this is a health pandemic. Also, any self-quarantines that may, hospital stays will also be covered. Sorry, I have a dog, so I had to close the door. Um, Another update on the legislation side in relation to unemployment that I wanted to share was that the unemployment benefits have been expanded to include not only people that have been laid off, but also people that have been unofficially laid off or furloughed. So you may not have gotten a pink slip, but you're not getting paid and not at work. And so those people are eligible to receive unemployment, as well as people that are what we call gig workers. So if you drive Uber or shop for Shipt or some of that other independent contractor work that in the past has not received access to unemployment, you will receive unemployment benefits. Not only will you receive unemployment benefits, but the federal unemployment contribution is $600, and it has been extended past the original period. So if you have questions, or if you know folks that have questions about the unemployment legislation, feel free to send them our way until the Google Doc, which is on our website, is updated with all of this information. Another recent piece of legislation relates to the stimulus package. So the $1,200 for every adult and $500 for every person under the age of 17. That is a thing, and it is coming very soon. It is coming very soon, and there are some caveats to who is eligible to receive that. There's been a lot of questions around how people will receive that, how will the IRS know, where to send it, etc. And so I'm happy to answer any questions like that you may have during our Q&A session. Another important piece of the legislation related to student loans. So student loans are federal student loans are able to be deferred for, I think, 4 months until September 30, I believe, because I know I quickly went in there and deferred mine. And so that is another piece. I'm happy to answer questions that anyone may have in regards to that. But with all this legislation and all this good stuff, we still see needs. We see a lot of needs. And so as legislation comes up, we see all the gaps that exist as people react and respond to it. And so we're still very alert, and I encourage you all to continue to keep your ear to the ground and find out who's being missed as they come out with these new legislations in an attempt to help people. One other piece of the legislation relates to retirement funds. So you can now withdraw from your retirement fund without penalty, and you do not have to pay the tax back right away. You get to split up the tax over a 3-year period. So that's also a very big win, although I would encourage you to consider speaking with a financial professional before making any withdrawals that are not mandatory at this time. But examples of things that we've seen, again, there are, even though we do have the expanded unemployment benefits, there are still people that don't qualify, and then there are lags in getting unemployment because the system overloads and you have to wait to receive your funds, etc. We also know that the stimulus does not apply to everyone. So if you owe child support, for example, you don't get it if you're a student and your parent, or a college student, and your parents file you as a dependent on their taxes, but you may have a part-time job in school, for example, or not even be living with your parents at the time for whatever reason, you will not receive that assistance. So there are still some gaps in special circumstances that exist, and that we are trying to figure out how best to understand and to provide aid for folks. So those are my quick updates. I can continue talking for a very, very, very long time. I want to sort of keep things moving since I was a little late. I see that there are 2 questions in the chat that were not questions, so we're going to keep moving. And I'm going to pause here to see if there are any questions or comments that anyone has. Yes, Ms. Brookins.
So I had quite a few questions because I've been trying to find some information. Um, a couple things you mentioned. One, with the stay-at-home orders, is it possible for us to, or do you think we should? I guess I should put that out to everyone. I'm sorry. First part. I am a member of the board. I'm the treasurer. Forgot about that part. But the other part is you mentioned there's a lot of stay-at-home orders, and there is a map of the United States and where those orders do apply. So I don't know if we want to put that map, but we have to keep it updated as more states start to issue stay-at-home directives, just so that if we're asking volunteers to do things, there are some caveats based on which state you're in, especially for like nonprofit, if you're going out and doing things, that you would be able to actually perform those tasks if you actually have to physically go somewhere. But just as a way of giving people information, because I know I've talked to a few people over the last few days, and they're kind of getting it confused with the shelter in place versus the stay at home. And the stay at home directive is a little bit more restrictive, and it penalizes you versus the shelter in place, which was kind of a suggestion, if you will. So maybe putting something on our site to know the difference between the two, and not to get it confused, because as you said, the minority population already is sometimes overly targeted. And if people don't really know in their specific state what the true directive is, they may not know what their rights are. So that was one question comment, if we should put that on our actual website, what the little map is of what the directives are right now.
Thank you. I think that's a really good idea. I am looking at that map that you're referencing, and there are only, right as of today, there are only 5 states in the entire country that do not have a stay-at-home order, and there are 8 states that have a partial
Shelter, yeah.
probably the shelter in place thing that you're talking about. So the rest of the states have a statewide order to stay at home. So thank you for that. I think that those are good ideas. I think because this is a map that is, because I'm looking at the one on the New York Times, and so I think this is something that's easily, we wouldn't have to manually update it because they'll
or
update
maybe
it.
does the CDC maybe have a map, or I'm not even sure if that who's keeping a good tally of just the newspaper sources. I'm getting mine through different sources for myself, only because of my industry and being all over the place on the East and Midwest and all that. I'm trying to keep track of it.
Yeah.
But the other part question was, you mentioned about the and I haven't saw all the legislation. The $1,200 or whatever the amount is that's supposed to come in this care package. Is there detail within the legislation that says who actually gets it? I know it says who doesn't, but does it say who actually gets it? Because not everybody is furloughed. Some people like me are actually working from home.
Yeah, no. So this is the stimulus. So this has nothing to do with employment or anything. If you have a social security number, you're eligible. And if you do not owe back child support, back child support, then you are eligible for the most part, unless you're over the age of 17 and someone can claim you as a dependent, you're eligible. So this is not in relation to whether or not you're employed or have had changes of income. This is just extra money that you do not have to pay back. If you've had changes in circumstances financially since your last reported tax return, then you will get paid based on what your last reported tax return is, and any overage that, or any amount that was due to you because you had maybe lost your job and you really qualify for a higher check. you will receive that as a credit on your taxes for next year when you file. And if you maybe got a raise since the last time you filed, for example, so you actually qualify for less than you received, you will not have to pay that back. So that's just a win-win situation for you. But I'm happy to answer more questions around the details based on what I've seen in the legislation so far.
Okay. I won't do an economics lessons right now. We'll just keep it moving. Thank you.
Are there any other questions? Are there any updates from other volunteers? I know last call we had, like I said, we distributed some various tasks, and I just wanted to know if there were any updates to some of the work that volunteers have been working on.
I'm sorry, I was muted. I had one thing to add to what you said earlier first.
Yes.
The student loans, I found out a piece of information, and you can correct me if I'm wrong, but with the student loan deferment, and I did a little bit of reading on it too. If your loan was taken out before 2008, you don't qualify for the same deferment. I don't know if you saw that at all, because the loans changed in 2007 when Bush signed the new order for the student loans. So if your loan was taken out before 2008, you can call your provider or whoever is servicing it and find out what they're offering you. Some of them are doing 3 months, but the interest does not stop because those were government-backed loans, but they don't function in the same way.
Yeah, so what I will say, for one, I wouldn't be surprised. I know the 2008 is common with a lot of the laws related to student loans, so I would not be surprised if that was the case.
It is, unfortunately.
but what I will say is this, the suspension only applies to federal student loans. So if you have your loans held through any other party other than Navient or MyFedLoan or whatever, then it does not apply to you, and you'll have to work that out.
And the federals, they weren't in existence before then, because I have, I have Navient, and it's the same thing. If it was before 2008, then it doesn't count.
Yeah, so I think that may be the case if you're saying because the law only applies to federal loans. So if the federal loan started in 2008 or whatever, and you had loans before then it doesn't apply. But for those federal loans, interest does not accrue. You do not owe penalties, and it does count towards your student loan forgiveness plan. So if you're on a public service forgiveness plan, public service loan forgiveness plan, and for example, you have 120 payments to make, the months that you are deferring or not paying, they will still count as though you were paying those months. So that's also another benefit. Are there any other questions? I did want to pause for a minute to talk quickly about what to do if you're sick or you think you're sick and those sort of things. But I wanted to give this moment, give this conversation its moment. So if there are other questions, or we will still have our full Q&A session, but if there's anything that I've spoken about so far that you have questions on. One thing that did come up, and I may share this more in the Q&A session, but I had a conference call with one of the schools in Detroit. They had a board meeting today, and I sat in on that and listening to their plans and what they're working on. So I may share some of that in addition to some of the needs that we've seen arise of I just got a question, so I got sidetracked. I will respond to that question. We also see that there's a lot of activism around prisoners and keeping them safe. And so even in Michigan and locally, they're doing a lot to release prisoners early so that they can not be exposed to the virus. And there's a lot of activism around that. In addition, there are organizations like Keep Growing Detroit that sell seed and things to grow for Detroiters to grow gardens that I think we could really partner with as we think about food security going forward, as things get a little bit more dire and among minority communities across the country. What are some alternative ways that we can make sure that everyone has food or access to something to eat, even if it's not, a hot meal? And we'll speak more about that in the Q&A session. One of the questions that came in related to the stimulus, there was a question around, is it based on AGI? It is based on AGI, so not your gross income or the top line, but the after deductions, your adjusted gross income. So yay, qualifying. And for couples, the max AGI is so 99,000 times 2, so 198,000 AGI for people filing jointly. With this, I would like to, if there are no other questions on what we've talked about already, I would like to take a few minutes to talk about what to do if you're sick. Before I get to that, there was another comment that just came in to the chat box, and it was something that I also planned to touch on a little bit during our call. So Bridget, I can address it now, or I can wait until the Q&A portion of the meeting.
Oh, you can go ahead and wait. I just wanted to say that.
Okay.
Because I've been seeing it a lot in the news.
Yes, you're absolutely right. But really quickly, I just want, and this will probably take 30 seconds, but I just wanted everyone to be aware that if you or someone that you are quarantining with are exhibiting signs of sickness, your first step is not to go to urgent care or to the doctor. Your first step is to call your primary care physician. They, at that point, will ask you some questions. Many of you may know about telehealth. Some of you may not, but most of the healthcare providers are encouraging people to use telehealth. So there are mobile apps that you can use so that you can do a doctor's visit from your phone. Or from the computer, so that you don't have to go into a doctor's office or a clinic physically. And so if you can do that, do that. If you do need to just call your primary care physician, do that as well. But that is your first step, to call your primary care physician, find out what's going find out whether or not your symptoms are something that they're recommending you go in and get tested for. If they say that you do need to get tested, you can arrange to have transportation if you're not able. And so various districts, especially in the city of Detroit, they have transportation set up to take people to the testing sites. At this point in the city of Detroit, and this is likely to happen, unfortunately, across the country, a lot of our primary hospitals have already reached capacity, and so we are pulling up makeshift hospitals in various buildings. So Ocoba was turned into a hospital. We have testing sites at the county fairgrounds, and Joe Dumars that was the last update I got of the testing sites, the drive-up testing sites. There are some different things that they're doing with the testing to allow it to occur more rapidly, and even change the delivery method. So they're talking about potentially sending people tests so they can test at home. But I'll preserve my opinions on this call. If you're interested in my opinions, we can have a private conversation. And so if you are sick again, you want to call your primary care physician, you want to test, you want to get transportation to a testing site, you want to self-isolate until you get your results. If you're positive, you definitely want to self-isolate or self-quarantine, I'm sorry. And even if a lot of times your primary care physician will say, you know, you're fine, or to relax. I don't know. They might not feel as though you need to get tested. I would encourage you to treat yourself as if you do have it. So continue to self-quarantine, social distance. If there are other people in your house, you cannot transfer the sickness to pets. So feel free to hug your dogs if you like them. But do continue to exercise all the sanitation and self-care recommendations that they have talked about in the news every day. A couple of things I wanted to talk about: maintaining your physical health. So even if you aren't sick, we're all at home. We all should be thinking about everything that we could possibly do to stay healthy. And so I want to encourage you all to eat well. I know that not everyone is vegan or pescatarian or has, you know, different diets, but during a time like this, it's very important to be cognizant of what you're putting into your body, because your food is your medicine, and it is what leads to your body being able to defend itself against invaders. So I really want to encourage you, if you can, to avoid things like dairy products, so butters, cheeses, milks, when possible. Try to eat a lot of alkaline foods. So there's a list that I can share with you all on different types of foods that can keep your body and your pH balance to a level that thwarts off disease and thwarts off invaders. You also want to make sure that you're sanitizing. So you want to sanitize frequently, you know, your door handles, your knobs, your light switches, your phone, your remote controls, your refrigerator handles and stove knobs, and anything that gets frequent touch, probably the refrigerator handle. Start there and just make sure that you're sanitizing very frequently. I know we all did it once, but you don't know if, you know, someone left that lives in your house and came back and what they were exposed to, or what, you know, may have transpired, or if you missed the spot. So just go ahead and sanitize it anyway. Make sure that you're laundering. So wash your hair, wash your clothes, wash your sheets, wash things regularly, because we do know that the disease or the virus can live on clothes. It can live on your packages that you're receiving. So I typically leave my packages outside for a couple of days after they're delivered. And then when I do bring them in, I still spray them down. I don't know if it's effective or not, but I do it anyway, peace of mind. And so just making sure that you're being cognizant, and then not only being physically healthy, but also staying mentally healthy, right? So I know that social media is a lot for a lot of people right now. And so if you need to go black for a day, or choose to check your social media once a day, or, you know, whatever you need to do to sort of limit your intake, trying not to watch the news all day, or picking certain days or certain times when you do watch it, so that you can sort of limit the mass hysteria that they're trying to impose upon everyone at this point. And then also there are virtual networks for physicians, or I'm sorry, for therapists. So if you do feel like you need therapy and you know, are unable to go visit a therapist, you can also do therapy online. There are a couple of databases of therapists all over the country that are waiting to help you, and then also leveraging your telehealth from your medical care provider. Also read, take time to take some free courses. There are tons of free learning courses that are available. Try to learn a new skill, keep yourself busy, plan for the future. A lot of plans have been canceled as a result. So planning for the future can also lift your spirits. And there's a lot of fun that can be had at this time. So try to focus on that, because things can get pretty dire and pretty dreary if we think about the what ifs all day. And the work that we're doing can lend itself to be pretty depressing when we think about all the need that exists. So I just want to encourage you all to stay mentally healthy as well. I'm going to pause because I see that Nakia had her hand raised. I don't know if you were playing with the feature or if you
I just got a question. When you spoke about the virtual therapist, do you know if there are virtual therapists for those who do not have benefits?
Yes.
Okay.
There are, yes.
Thank you.
Are there any other questions or comments? All right. Okay, so this portion of the meeting, I'm going to open it up to Q&A. I know that, Ms. Brookins has a question, and then I want to talk a little bit about Bridget's question and some of the other things. So please feel free to ask your questions. Ms. Brookins, you can go ahead.
So you mentioned quite a few things as far as like resources and things that we can do as, individuals. I mean, because, we're a task force, so we're board. So you gave us a lot of good information. Do we have that, like a listing of where some resources are available? Because the
Yes.
resource that we're trying to put together, that will go awesome on it.
Yes, that will definitely be part of our resource share. I will try to do this, that little PSA for our future calls as well, because we have a little bit different attendance at each call. So I want to make sure that I drive that home. But yes, that will be shared in our resource share.
Okay, because that would be, and I also have as far as like some resources, because I think I saw part of Bridget's response. I am a member of the AARP, so I will also provide some resources from that organization for older people who are, potentially being scammed.
Yes, I did see the AARP information that came in. Although I'm not a part of the AARP, I have clients that serve people that are part of AARP, and so I have to be abreast to all of their news as well. So I get all of their alerts and news, and I shared some of that to our COVID at MI Freedom CS email address to be added to that Google sheet that you're working on as well. But to give you an example of give you all examples of some of the foods that you could eat to help keep your pH alkaline. Lemons, limes, avocados, garlic, mangoes, tangerines, pineapples, dandelions, or oranges. I know some of that is a little exotic, and none of it has a long shelf life, so it might not be practical. But even if you can get garlic powder and just put that on everything you eat, if you can't get the fresh garlic, for example. So those are just some ideas around the foods that you can eat. Yes, dandelions, I know. So I just wanted to touch base on Bridget's question, and Bridget also had some other comments that I am happy to hear and have her share with you all regarding her experience. But in regards to the scams, and so one of the comments that the FDIC shared were, they have resources available on their website for community organizations to share with others in regards to some of the scams that are going on. Anytime there's new legislation or just the presence of this mass epidemic, people are going to take advantage of it and try to scam people. And so we saw it early on on the tech side of things. I think like the first week in March, I started getting alerts on the tech side that there were, all these cyber attacks and cyber crime around coronavirus. So people calling people's numbers or robocalling or emailing and trying to get them to click on, if you have coronavirus, click this, or if you don't want coronavirus, click that, or just various things to try to use it as a scare tactic in order to hack into people's machines or accounts or steal identities, etc. The FDIC talked about people calling or people receiving calls from claiming to receive calls from FDIC members asking them for, their social security number or their bank account information or whatever you may have. So it's really important that we also share information and be a source of legitimate news, that no one will call you and ever ask you for your bank account number. That's just not going to happen. Your bank is not going to call you and ask you for your bank account number. They're not going to ask you for your PIN number. They're not going to ask, most of the time, they don't even ask you for your full social security number. They might ask for the last four. But you always want to make sure that who you're talking to is a real person and calling on a legitimate on behalf of legitimate business. And so there are different things that we can do with our social media campaigns, on our website, text blasts, email blasts, and even in mail, because a lot of people don't have access to internet at this point or access to those avenues on a regular basis. And so just spreading awareness and doing different campaigns to make sure that everyone knows how to spot a scam. There are a lot of resources on the FDIC, on pretty much any major financial institution or group or that you could think of, to have various literature around how to prevent scam or identify scams during this time. So we can definitely just use what they have and maybe make it a little truncated or make it, add our logo or do little different things to the information, but we don't have to reinvent the wheel is the message there. Are there any other questions that I did not touch on? I did want to remind everyone that if you do notice any violations, for example, if your job is making you go to work and you're not an essential employee and they're threatening to fire you, for example, or whatever you may have, you can report them to your state attorney general's office. Depending on your state, I'll be happy to connect you with that person, that number. Also, at this time, it's very important that we self-advocate. So contacting your legislators, letting them know, what your needs are is very important. There's strength in numbers. So a lot of what we'll be doing is listening to what the needs of the community are, and then in turn, submitting in conjunction with lots of other nonprofits and organizations, submitting to different legislation or legislators to make sure that those needs are heard and understood. But are there any other questions or concerns that people have or want to share? I think India had I see. It looks like India's number. Sorry, I kind of memorized your number. One of the questions that I got was in regards to whether or not to wear a mask or not. So in the beginning, there was a lot of controversy around wearing a mask because people were saying, or authorities were saying, that if you're not on the front lines or a healthcare professional working with people that are sick, or if you aren't sick yourself, that you don't need one. I think a lot of that was based on, supply, trying to mitigate supply shortages. Now they are transitioning and saying, even if you aren't sick, you can use a mask. It doesn't have to be the N95 mask. You can just, even if you have something, you can make a mask There are some organizations like Gleaners that are asking people to sew masks for them so that their volunteers who are going door to door can have something to use. And so I think with that and a lot of the guidelines and even the symptoms that you see of the disease, a lot of that is going to change and morph as we get more data. We know that the US is leading the world right now in COVID cases, but that most likely means that we're leading the world in testing. We do have, not only access to testing, but we also are a lot more transparent than, for example, China. And so our numbers are probably more realistic to what's actually happening or what they are aware of actually happening versus what we choose to share. And so you can take that with a grain of salt and do with it what you will, but that is the news. Bridget, I see that you're unmuted, so I didn't know if you unmuted yourself to ask your question or.
Yeah. So hi everybody. Basically, I messaged to Quian earlier because I was getting frustrated just for my neighbor kids because they have to come use my Mac computer, and obviously I'm not going to send it over to the house. But the iReady and the Clever, it's called, don't work on PCs or Droids or the non-iPad tablet that they have. So it's just kind of frustrating because I feel like there was already such a gap for Detroit school systems versus, the rest of them. And just kind of what I could do to help that. And like even the other day, my neighbor, she went to go pick up packets like for the kids, and they ran out of them somehow, like by like an hour and a half in. Yeah, so I've just been kind of thinking of ideas like to get teachers involved, maybe with some kind of, reward-based system. I know I gave one of the kids a skateboard, like a friend of mine, he's like sponsored by a skateboarding company, so I like got a skateboard. I mean, bribery works, or even something like to the parents, that way to get them involved, whether it be like free supply of groceries or, just something in the future. And also museums are like pretty much giving away like $3 admissions for once this is all over. So that could be another good way to go, like that kind of a prize or something. Or like a spelling bee, just a way to make it more fun for kids to learn, because I feel like it's just not working.
I think those are really great ideas. So we have an educator that's not based in Detroit, but based in the Chicago area that is going to be working on some of our programming for how do we support kids and parents right now. So I think those are really, really great ideas. And as we're seeking funding from foundations and government sources at this time to support our efforts and support our task force, to provide direct aid, to provide technology. I think that is a really unique spin. How do we incentivize kids and parents to do the work and not just incentivize them with something that doesn't matter, but it's meaningful incentives. And I think the recommendations you have are really good. Can you clarify something for me in the beginning? I kind of missed it. You said something about okay.
So I even recorded the kids because I was like curious and I wanted to use this later, but this is like 3 of them. What happens when you already? Can you hear this?
Yeah, we can hear it.
Have you tried opening it in another browser? What devices have you tried using it on? Computer, phone, iPad. And then his tablet. Right, he has a tablet. So all 3 devices you have at your house can open iReady. All right, we got 2 accounts saying that is correct. So yeah, they're over at my house like every day, which isn't great for social distancing either.
Right, and that's really interesting. So one of the schools that one of the schools in Detroit, it's a charter school that I was working with, they're working on right now, obviously all of their kids are at home and they have paper packets, and they're also offering online Nakia, I do see your comment. They're also offering online and trying to transition more to the online platform. So I think just having all of the educators come together and understand what the limitations are and the best way to deliver online content, because something like that they may not consider or be thinking about that. So having the
Oh,
technology.
and the teachers in like Birmingham, they're just, they're being pressured a lot more to put more, extreme coursework out there, and like they're getting all kinds of stuff, and they gave all the kids devices. I have a teacher in that, or a teacher friend in that district, and like, I mean, she was more than willing to send me some like workbook stuff that she has. So like just compiling like something to give out, or just something easy.
Yeah, and there are a lot of free online resources that are available to like print packets. And so that if we could even either us or reaching out to the schools to have them do that, if we could, print packets and mail them as like a volunteer thing that we could
Or
do.
FedEx, because I mean, they're open, they're having to deliver stuff.
Right. Nakia, I see that you wanted to, I know that Dana, hi Dana, hi. I know that you're an educator, and Nakia was just in the chat reminding me of that. So I don't know if you had any comments around the student issue.
Hello, how's everybody doing tonight?
Pretty good.
Pretty good.
So I can say that for right now, at my school, I'm in Southwest Detroit, we offer Khan Academy as another option from the paper packet. We had options where parents could come pick up packets, but once the shutdown got a little bit more serious, we couldn't allow them to come in and pick up the packets. So our office manager was actually mailing packets out. I do know that once the governor makes the announcement as to whether or not school is going to be done, we have to come up with some other options as far as supplemental instruction. So we're not teaching new standards, we're remediating right now. So it will be something that will get put together for students, whether it's paper, online, or a combination of both, because we're gonna have to make some decisions about advancement to the next grade. For the most part, I believe all students are going to advance, but we do have to have something to grade them on if they're not going to come back for this year. So I'm pretty sure everyone is kind of mulling through the different options that we can offer students right now, and we will have a more final concrete decision within the next probably week or two.
So what are you doing as an organization to ensure that all of the students have access to technology in order to do it online? Because 9.9 times out of 10, the school year is not going to resume. Other states have already done it, and the governor has already alluded to it several times that we won't be reopening for this school year. And so I think it will, instead of waiting for that to happen, it would probably be better to just assume that that's the case and start working on those efforts already. But I was just curious from a internal standpoint, like what does that look like? How do you determine the technology needs? I know that there are a lot of free, like for example, Comcast has Internet Essentials. So if kids didn't already have Wi-Fi at home, we could assist in getting their household set up on the internet. But what is the school, from an educator standpoint, what is the school's plan of action for determining student access to online? Like, how will you address that or consider that?
What we've been doing is just giving everyone the option to do either or. So we communicate with our families through Class Dojo, and we have about an 87% participation right now, with all parents being signed in the dojo. We communicate with parents that way, like just as far as pickup and the lunch pickup, the grab and go pickup, just so that we can stay connected with them. And through that resource, we give them additional ways that their students are able to sign on. So if students don't have access to the internet, they were given the paper packets that will keep them, occupied or educated for that first part of the shutdown. But as of the continuance is going to happen, as of, when she makes her announcement tomorrow, I was not a part of that conversation earlier this week, but We do plan to update our staff with, you know, the updates of how we plan to move forward. But pretty much if they don't have access to the internet, it's not a requirement that we can hold against them. But we did want to make sure that they at least got the paperwork, or they have the access to the Khan Academy or the Adventures website, or the Class Dojo videos teachers post where they teach mini lessons. They at least have that piece of it where they can look at that through a phone or an iPad.
What do you think about the idea of us volunteering to print off stuff and send it and mail it to students, or mail it on behalf of the schools to students, to sort of help offset the administrative burden of the school?
I think that would be a great idea. I mean, that's what we've been doing. We kind of had the teachers put together the work, and then administrators went to the schools before we weren't able to go back into the building. And we just, you know, printed off copies. We called parents. We sent, you know, mailed things off. We dropped stuff off at people's houses, whatever we had to do to make sure that everybody at least had something before, you know, things got out of control. But I think, we were actually talking about this today as far as us being able to go back into the schools and prepare this next round of packets that's going to need to go out. Only a couple of us will be able to actually go as essential workers. So it would have to be something where it wouldn't be too many of us going to get it done. Right. But I think it would definitely be a good idea to do that and at least have it where parents can drive up, you know, pick up and keep going.
And then do you notice that the teachers need, just thinking about the professional development of the teachers, with the different method that the teaching is taking place, are there opportunities or skills gaps that need to be met on behalf of the teachers? Like, is there a need, do you see, for teachers to, who were used to being in a classroom, but now they have to be online, or now they have to communicate with the parents more often instead of students, or figure out best ways to, like, just the different dynamics of how their work gets done? Do you see a need for more professional development, or different professional development for teachers as a result of this?
I think so, but I also think that the way this situation happened, it kind of hit us all at once. So it was very much, we commend the teachers on their, you know, ability to adapt to this situation, because they just kind of took it and ran with it. And this year we actually had a technology teacher, which was the first time we've had a technology teacher in my almost 10 years of being with this school. And he's very, you know, well-versed in all different types of programs. He's certified to teach Google and Google Classroom, I think, or whatever the program is, surrounded by Google. So whatever the teachers didn't understand how to do, we had someone who we can connect them with, and he's helped tremendously. And then we have a couple of our administrators that are very well-versed with Google as well, who were able to link teachers up on Google Duo so they could teach their classes, show them how to use Zoom. So I would say maybe it was about a 60-40 split, with 60% really being comfortable with it and 40% not, but that 40% really just picked up the slack and figured it out very quickly for us to be able to get this thing up and running.
Okay. There is an organization called I Assist Youth that offers online tutoring, specialized in math, English and reading, and science on specific times, Monday through Thursday. I don't know if you're familiar with that. I'm saying that so that all the parents can hear that. And so maybe leveraging organizations like that, where they also can offer tutoring, because I know a lot of parents right now are facing the brunt of trying to be a teacher in the absence of teachers. And so being able to offset that with some dedicated specialized tutoring, I think will also be a really good resource to share. But thank you, Dana, for your comments. I want to, because we're coming close to the end, I do want to switch gears and talk about some other things. So just wanted to encourage everyone, as you're you know, communicating with people in the community, answering questions, a very good place to refer people is 211. So pretty much every state, maybe I think, has it. If I could talk, it would help. Has a United Way. And so locally, the United Way for Southeastern Michigan has the 211 resources, and they have everything from, if you need diapers, if you need, money to buy food or to pay your utilities, or you need hygienic products or pet food, or, small business assistance, or need help getting unemployment, whatever you may have. But that's a really good resource to direct people to, where they can just call a number and get that aid. So I just wanted to say that. There's also an organization called Just Shelter to help people prevent eviction, get affordable housing, and reduce homelessness. So they advocate for tenants' rights. We know that as people are facing precarious employment situations, that we want to make sure that people aren't losing their homes, and renters aren't being stiffed by landlords. And so that's another resource that you can refer people to, and we'll also have on our website. I just wanted to take the time to sort of highlight some of the things that are in our COVID at myfreedomcf.org email address while they're sitting there as they're waiting on their transition to our website. So again, there's about almost 100 different resources and databases that are in that email inbox already, and it continues to grow each day. So over 100, I'm sorry. And so with that, I do want to see if there are any other questions that I can answer. I see Nakia has her hand raised, and Bridget has another question. So Nakia, if you could ask your question.
Oh, okay. I'm sorry. It was up from when we were speaking about the school. My aunt was on the call last week, and she shared with me, and since you had, you mentioned, would it be helpful if we made copies and or mail it off? In her school, which I volunteer a lot throughout the school year, she serves an underprivileged area, and when the schools closed down, they did do the packet thing. But in the Detroit Public Schools, what happened is they closed so many of the buildings that they've moved the pickup 3 times. And when she reached out to her parents, and she teaches special education, they can't even get to the sites. So you can't do any type of transportation to get to the neighborhoods unless you're like Ubering or something like that, which is not happening. So they're not able to get to the packets, and they don't have internet access, and they don't have computers. And some of them were complaining because they heard about the districts that were giving out like the tablets and the computers, and they don't have those type of resources. She went to the school on the last day and picked up a packet, and this is how great some of our teachers are, a lot of our teachers, just to support them if they needed to call her at home, and she can go through and see what they have questions on. And she said she wished she had made packets. Well, she's already this week, and her using her own resources, just went and made packets for all the students that she heard from. And she's literally dropping them off on the porch to keep social distances. She's literally driving to each and every house this weekend and dropping them off on the porch. So the teachers who can't do that or not able to do that, their students just won't have anything because they don't have cars and they don't have a way to get to a school that's out of the neighborhood because their schools aren't open to pick up packets in DPS. They only have like certain assigned schools you have to go to for everyone in the district.
What I will say, yes, so I'm definitely from the camp that we should be mailing those rather than having people come pick them up.
Right.
Because that's just another reason for people to have to leave the house and to have gas money and a car and all of that. So I do strongly believe that should be mailed. So yes, I agree. So Bridget had a question about bus routes. I know that locally the city of Detroit has been offering free transportation to critical things such as like if you need to get testing for COVID or if you need to go get food. I guess it would depend on what the nature of the transportation is, like where are they going? Also,
I was more so talking about like the school bus, you know, like if there's really concentrated areas, like getting that bus route, you know, the stops up on that way it'd be easy to hit, you know, multiple houses and, you know, it could be sort of like spread out.
right. Yeah. And I know the city of Detroit, each district and the city council, but each district of the city of Detroit has weekly teletown halls, if you will, similar to this, where they have reports though from each department, and they accept questions and concerns from the citizens. So I would encourage all of my local people to participate in one or two of those. Maybe if you like find your district, that might be the easiest thing rather than trying to participate on all of those because they're frequent and it's a lot of information. But I think that that's a really awesome tool. They also have an email listserv where they share lots of information about how to get resources and what they're doing. And there's tons of stuff that the city is doing. I mean, tons of stuff. So definitely will encourage anyone to join those calls with me because I do listen to those. I think pretty much every day of the week they have those calls. So you can feel free to ask questions and also hear about the status of various departments, from the health department to utilities to small business to transportation, housing, or taxes, whatever. That's another resource. Are there any other questions? I know it's getting pretty late and I want to be sensitive to folks' time. Did anyone have a question that did not get addressed?
Didn't have a question. This is India. Sorry, I finally got through. I just wanted I just wanted to mention that scholarships, obviously for college, are happening all throughout the year, but April 1st marks the opening for the spring. So I know a lot of the things that we talked about were things that we can do as parents and educators and all of that, but the kids also need to have something to do too. So being able to go on the web and search for those, and they're open to a lot of the kids' grade levels. It's not just the kids in high school. It would give them something to look forward to and to do throughout the week.
Yes, I think that's a great idea. And maybe if you could remember, or Nakia could remember, to relay that to the Youth Advisory Committee, since the chair of the Youth Advisory Committee is in Nakia's house. But I think that's a great. I think that's a great idea. One of the questions that we had at the last meeting was kind of around scholarships at this time, and our students at risk of losing their scholarships, and how do we find out and communicate and help students who might be losing their scholarships. For example, if they were on a basketball scholarship and the season was canceled because of COVID, or they were an art student and they can't do the art or finish whatever you may have. And so trying to figure out what needs, or I would assume that a lot of the scholarship organizations and funds would be understanding at this time and maybe just postpone, and I don't even know what the schools how are they charging kids at this time. So I guess there's a lot of intricacies that go into play there. But that's another thing that was brought to our attention last week that we want to continue to research and poll the community to find out what the needs are. Are there any other comments or questions, concerns? I do want to, if there are none, I do want to give a couple of reminders. So please do continue to invite people to these calls. We're going to have them every Wednesday night until we don't need them anymore. I'll say that. And so, however long this thing lasts, and however long the needs of the community exist as a result of COVID-19, we will continue to meet and try to come up with ideas and address the needs of the community. Same time, same place. I will eventually start broadcasting these on Facebook. Once I feel confident that that won't impair the sound quality. And then if any of you would like to participate in some of the phone calls I have with either, the governor, any senators, or the city, please let me know. I would love to have people help me listen in on those, because it is a lot of detail, a lot of information. And it's nice to have more than one person listening in and having that knowledge. If there are any new people on the call that want to volunteer specifically for the task force or for any in any capacity for the Minority Freedom Community Fund, I would like to extend that invitation to you. You can reach out to myself or to our president, Nakia. I will put our email addresses in the chat box, but most of you already have my contact information, and I'll be sending out a summary of what we talked about today via email after the call as well. With that, I don't see any more hands raised. So I want to encourage you all to stay positive, stay healthy, stay safe and sane. And I will see you all again, hopefully next week. Please invite people and share share the event on your social medias if you're able. Also, remember to follow us on social media, Instagram, Facebook, and Twitter. We're live, and subscribe to our newsletter if you haven't already. Thank you all. Good night.
Thank you.
Night.
Thank you.
Thank you.
Good night.
Good night.